Well, as I said earlier, we are in the middle of the UN weeks here in our city, Busan. And last week, Busan Global City Foundation held the 2024 World Peace Forum. And a highlight of that forum was a special session on the world without war, that whole concept of that. So as listeners, wavers out there of Morning Wave in Busan, I'm sure you are acutely aware the world is going through two major wars. And no signs of easing up. And these are just two of the major ones. There are conflicts all around the world. So unfortunately, civilians, they're the ones that are suffering, and they continue to do so. And we're talking about not just, adults, but also children. We see those awful stories day in and day out, exposed to violence, disease, and risk of famine as well. And there are many organizations on the scene trying to bring aid and assistance to those in need. And one of these groups, these associations and organizations is, in English, we call it Doctors Without Borders. In Korean, that's 국경없는의사회. And, please forgive me, in French, Médecins Sans Frontières, MSF. And today, we have two representatives from that organization in our studio right now. So we're going to say hi to them first. So let's say welcome to both of our guests. Welcome, and thank you so much for coming in today. We appreciate it.
Yeah, thanks for having us.
Yes. So if you could get a little closer to the mic. And so first of all, let me introduce our two esteemed guests here. First up, we have Dr. Jessa Pontevedra, who is a medical coordinator for MSF. So she's here. And also we have Dr. Emma Campbell, executive director of MSF Korea. So they're both here in the studio with us. So maybe you can do a better job of introducing yourselves to our listeners. So who would like to go first?
Why don't I start?
Sure.
So I'm Emma, and I'm the executive director of MSF Korea.
Yes.
I've done 3 missions with MSF previously in Sierra Leone, Turkey and Lebanon, and also Eswatini. And also I did my PhD and master's looking at politics and society of the Korean peninsula. So
really,
I'm very passionate about MSF, but also very passionate about Korea as well.
Right. Well, thank you for telling us a little bit about yourself. And now we're going to turn to Dr. Jessa Pontevedra. And both of them have given me permission to call them by their first name. So don't think I'm, disrespecting the doctors. So can you tell us about yourself?
Thank you for that. So I'm Jessa, and I work as a medical coordinator for Doctors Without Borders. I've been with Doctors Without Borders for about 13, 14 years now, and I've done maybe 35 missions above.
35.
Mostly in conflict zones. So I was in places like Sudan, Gaza, Ukraine. I was in Lebanon before the current conflict started. So yeah, very happy to be here.
Oh, well, the honor is all ours to have both of you amazing, amazing ladies here. So if you can walk us through, Jessa, because I hear that you were at the World Peace Forum, right? And so last Friday, tell us about some of the key points that you discussed at this important forum.
Yes. You mentioned quite a few of them at the very beginning, which is great. So I basically discussed about the horrors of war. As Medicine Sans Frontières, Doctors Without Borders, we are in these conflict zones wherein we try and ensure that civilians have access to essential health care. So I spoke quite a bit of the things that we see on the ground as impact of war, the human toll of war, and conflict and violence. And then I also spoke quite a bit of the importance of peace. This is such a very important topic to discuss now. We try and address the immediate impact of war, but at the same time, it's essential that we already set groundworks for peace, and we advocate for long-term peace.
Indeed.
And of course, what's also important is that to get across that healthcare should never be a casualty of war. Right? We've all seen this, how children have suffered the impact of war on mental health, the long-term impact on the future. Healthcare should never, ever be a casualty of war. We need to set groundworks for peace, for long-term peace. So these were the points that I touched on.
Oh, that kind of just struck at my heart, because I think oftentimes we're so lucky here in Korea. We sometimes take healthcare for granted because we have such a great system, health insurance system and whatnot. And sometimes we don't think about the fact that people around the world, they actually don't have access to even the basic healthcare. So that's a great point that you made right there. Well, maybe for our next question, both of you can answer. Jump right in. We're going to delve into the actual work that you do with this organization. And as an American, I'm just going to say Doctors Without Borders, or MSF, right? So can you give us a general overview of this organization? What kind of medical services do you provide? Because I'm sure many people, our listeners, they've heard of your organization, but maybe not quite sure. What is it that you exactly do?
So MSF was established in 1971 by journalists and doctors. And we've now grown into an organization of nearly 52,000 people working in over 70 countries. And we deliver medical humanitarian aid to populations in distress as a result of conflict, exclusion from healthcare, natural disaster, and epidemic. One of the key characteristics of MSF is that we are neutral, impartial, and independent. That means we don't take sides, particularly in situations of conflict, that we will serve any community based only on need, not taking into account characteristics such as ethnicity, nationality, religion, or politics.
Yes.
And being independent means that we receive 98% of our funding from private sources. So we choose where to go based on need, not on where our donors, such as governments, want us to work. So these are the key characteristics of MSF.
Wow. So that's really important to know. Is there anything else you want to add?
Yeah, and for medical programming, for example, very clear examples of what we do is, for example, in Ukraine, right? We still continually do it now, but during the beginning of the current conflict, we were providing primary health care. So that's basic consultations as well as mental health consultations everywhere, right? Like where people need us, where people need access to healthcare, we are there. So I experienced being able to provide like a medical care from houses, schools, bomb shelters, train stations, inside trains, inside a moving car, wherever people need access to healthcare, that's where we are. In Sudan as well, for example, right now, amidst quite heavy bombardment still. We are there providing basic sanitation, food, hospitals. We have our teams digging latrines, for example. And then in Gaza, as I think we've all seen and heard, we have field hospitals.
Yes.
So even in constant bombardment, our teams, our locally hired staff, international staff are there to provide health care to the civilian population that need it. And not just these, we also do maternal and child care. And then vaccination campaigns. That's right. To these types of populations.
There's so much that goes on behind the just the emblem and just the organization's name. There's a lot that goes on. Thanks for sharing, both of you. For our next question, maybe you can tell us about specifically Jessa as the medical coordinator, and then Emma as the executive director of MSF Korea. Maybe your work does overlap, but I'm also thinking that you have separate objectives that need to be reached, right? Goals. Yes.
Yeah. So my job as a medical coordinator, I'm oftentimes in the field or in the mission. So anytime an emergency pops up, we go in, and then we are the ones to be looking at the needs, and based on those needs, we try and design medical programming to be able to address the different needs of the population. And then we also do the negotiations with, because as much as possible, we
Yes.
try and work with existing systems already, because
see.
that's also another point that we do as Doctors Without Borders, right? Like there's systems in existence to be able to provide healthcare and other needs for population in different countries. We don't, when we go in moments of emergencies,
Sure.
we try and not break these systems, but rather ensure that long term it's still in existence. So we support existing
Yes.
systems and all of these things. So that's kind of like and then of course I can also do consultations if needed,
yes.
because that's also another thing that's needed. When there's conflict, for example, or emergencies, oftentimes healthcare professionals from the countries are affected by it as well.
Of course, yes.
So we try and come in and support that and facilitate as well that they can continue to do their jobs and provide healthcare to the population.
I see. And I'm going to turn to Emma now. So tell us what you do.
So my job is really to support the work of people like Jessa.
Yes.
And primarily that's done through fundraising. And the Korean community have been extraordinarily generous in their support of MSF and its work.
Oh, okay.
And we've seen a very significant increase in the contribution from Korean donors to MSF, and that's enabled us
Great
to
news.
expand
Yes.
our work and carry out the kind of activities that Jessa is talking about. Another very important aspect of my work is to recruit Koreans to go to the field. We have tremendous medical practitioners in Korea,
Yes.
doctors, nurses, pharmacists, mental health professionals who are making a huge contribution to MSF. And we also recruit logisticians, people who work in supply, water and sanitation, in engineering, as well as administrators in HR and finance. And we're sending more and more Koreans to the field
I
to
see.
support our activities.
Yes.
And lastly, I do advocacy and awareness raising of the issues that we're seeing in conflict or around epidemic, working to encourage the Korean government to provide aid and support, and also working with companies in areas of developing diagnostics.
Yes.
And vaccinations, and we're seeing lots of exciting initiatives in that area. So Korea is contributing in many different ways, and my role here is to work with partners in Korea to support the work that we're
To
doing.
encourage it even more, I'm sure, right?
That's right.
Yes. Well, I'm thinking I'm going to turn to Jessa for a moment. Because of the very nature of this whole, Doctors Without Borders, MSF, the members, I'm sure, the people, the doctors, the nurses, the pharmacists, and so on and so on. Can you actually tell us about the conditions? Because earlier you both mentioned mission. So first of all, how long is a mission? Is there a set timeline, or is it kind of fluid? How does that work? And then tell us about the actual working conditions.
Those are very, very good questions. So missions can be varied. We have different forms of field. We call them field or missions.
Sure.
Mission types. So we have the regular missions and emergency missions. Regular missions are the more longer term. We try and address long-term healthcare needs of a specific population, and so it's in more stable conditions.
Okay.
Right. So when you get deployed or when you get sent to a stable mission or a regular mission, it can be anything from 6 months to a year of being in the country. Of course, you get breaks in between that.
Yes.
Because it's very important. Mental health is very, very important for all of us. And rest is very, very important for all of us.
Sure.
So that's a regular mission. In emergencies, for example, if you get deployed in outbreak situations like the Ebola outbreak in the past, or conflict contexts, which is happening a lot these days, these are high insecurity contexts, we call them. So then your mission or your deployment could be short, anything from 6 weeks to 3 months, right? Because it's quite high intensity, and the work is really like you keep working, and so it's very different. And the second,
with like the vulnerable conditions, I'm sure it's once you're on the ground in an area of conflict, I'm sure there are challenges and obstacles and difficulties.
Yes. Where to start? Like it's difficult, and up to now, our teams are still continuously facing these challenges of how to navigate an active war zone. Right, that's one of the biggest challenge that we have.
Yes.
Navigating an active war zone to be able to provide impartial health care to civilian population. It's that. I think it's one of the biggest challenges. And then the fact that, some warring factions, the international humanitarian law and the rules of war are not being adhered to more and more. This becomes even more difficult for us.
Yes,
right?
yes.
And so, like, in practicality, what does that mean? So we get sent into these highly insecure contexts. We have our mechanisms to do our risk analysis based on international humanitarian law, rules of war.
Yes.
If these are not adhered to, what can we base our risk analysis on?
Right.
How do we figure out, we need to have safe space for healthcare.
Yes, absolutely.
Whatever is happening, we need to have safe space for healthcare. Hospitals, healthcare should never be targets.
Yes, I thoroughly agree with you. And I'm going to turn to Emma. I want to ask you a different question because we're almost out of time, and I wish we had like a whole hour to do this. But if you could pinpoint one issue that you really want the public to focus on, what would it be?
So I think a really key issue for us is international humanitarian law. We're seeing that increasingly in conflict zones, civilians, hospitals, humanitarian workers, medical workers are being targeted.
Yes.
And if we do not have the protection of international humanitarian law, we simply cannot carry out our life-saving work. We know the human condition means that wars will continue, but there was one thing that allowed civilians to at least access the healthcare and life-saving support they needed in those types of situations. And we're seeing that protection through international humanitarian law being eroded. People are targeting civilians' healthcare centres with impunity. And that is a really important point that we all as a community need to address and take ownership of if we want to continue to deliver humanitarian aid in conflict and other zones.
Indeed. Well, to wrap up our conversation today, I'm going to ask each of you for a short message. What is it that you really want to bring across to our listeners and viewers, not just in Busan, but we have listeners from all around the world. So I'll let you go first. So what are your final words?
So first of all, I think it's very important, the discussions that's been happening here in Busan, particularly around peace. And from my side, I think I'm going to repeat what I said during the forum, that healthcare should never be a casualty of war.
Right. Yes. I take it to heart. I feel it, and I thoroughly agree with you. And I'm going to turn to Emma for your final words.
I'd like to emphasize the importance of Korea and the role that Korea has to play in addressing humanitarian needs, both through funding, humanitarian crises, the role of the Korean population in participating in humanitarian activities through organizations like MSF to bring the expertise and knowledge to populations in need, and to say thank you to the Korean community for their support of MSF and humanitarian principles. And
well, I think I speak on behalf of Busan and everybody here in Korea to thank you, amazing human beings, for doing the work that you do and representing your organization so well. So thank you so much for coming in today, to both of you, for this very special interview. So the pleasure was all ours. Thank you so much.
Thank you. Thanks for
Thank
having
you.
us.